Hey everyone, I wanted to make a quick video to tell you guys about um, what the doctor said that was happening to my arm and my shoulder. Um, the conclusion for her was very easily made, and she quickly came to the conclusion that I have what is called frozen shoulder. Well, that explains the stiffness, the pain, the limited range the range movement in the shoulder. Simple tasks like removing my t-shirt, taking off a blouse, it hurts a lot. Especially in the night, I can have a lot of pain when I try to sleep on it. I try to avoid it, but when I fall asleep, I just twist and turn, and sometimes I end up on the bad one, and it will definitely wake me up if I stay on it too long. The cause is probably because I have had many times, like 5 or 6 times, that my shoulder got dislocated. So it's a very sensitive area, and we believe that also due to the fact that I am scared to use the arm because it's so easily for it to pop out, that I am holding it a little bit stiff. I don't trust my arm. That's basically the thing. I don't trust my arm. I don't trust my shoulder. I've had physiotherapy before. I ended up not going anymore because I had really trouble with the whole touching part, and now I understand why. Um, but I got a physical exam. I had to lift my arm, and this is the right arm, and I had to do movements. She would twist my arm like the outside and would look how far it could go. And she was a bit shocked that for my age, it was so limited. I will kind of show you. Taking off a blouse is like a problem because normally you can do like this, and I can do that with my left arm, but with the right, you can see it's a bit painful. Yeah, it's very painful. So I had to stand up, and I will just stay seated now. But I had to raise my arm, and this one is like no problem. You can see it can go all the way up. Now we'll try with the right arm, and here it starts to get painful already, and I can have him like that, but I immediately feel like a crunching sensation. I feel myself getting tense, and I'm getting anxiety from it. But I also feel really like a pain, and it's here on the top here, and it goes all the way down, and sometimes it goes all the way through my hand. It feels numb, it feels like tingling. So yeah, so those were the kind of things. She would also try to pull my arm so out like that, and with this again, it's very limited. It's very hard for me not to just move my torso along with it. So yeah, that's not great. Let me put this on. I also asked about the popping noise that I hear sometimes when I take off my shirt because I have to lift it. She said that that could be like a muscle or something, and that snaps back, or nerve or something like that. I don't really remember it well. And she said it could be like snapping back into place. So, well, it's a good thing that I know, because then I can tell myself like it's not necessarily meaning that your arm is going to dislocate any time, any moment. So that's good. I have a really kind doctor. I felt really like she heard me, and other doctors have said to me like, well, it's all in here, and we both figured like, well, it's not, because you can see the difference. You can see that I am in pain when I try to use my arm, the right one. Yeah, more like this, the same way like I try to do things with my left arm. It's really, so I feel like, well, this is it, it's frozen shoulder. The next step would be I am going to have to find someone that can give me physical therapy. That's very, oh, I don't know, scary, because another new person and someone that has to touch me sometimes at the arms, and I have to have a new, confident to go there and just do it. But I'm willing to, and I am going to really try to not quit this time. So she recommended me to someone, and well, I just hope that it's gonna be okay. I can take painkiller. We're gonna try with the usual, where what you can buy at any store. If that doesn't work, so so get in contact with the physical therapist, and they will discuss what kind of medication would be better, or maybe even I need an injection. So I'm not looking forward to that. So I hope that doing physical therapy will help me, and some painkiller will help me too. But well, if I need injection, then I'll just have to just do it. I'm not scared of injections or anything, but anything that gets clear, comes closer to this part, I am very like, no, I'd rather not. But it would be helpful, the injection, to help me with the pain and maybe lessen some of the swelling that I am experiencing. Well, she said if treatment doesn't work, if the physiotherapy and the medication, it doesn't seem to be going, or giving me a lot more movement, then probably surgery will be needed. And that one I really hope to avoid, because that's like having to trust other people completely. And that's just, I don't know, that's the most scariest thing that can happen to me right now. But for now, I'm just gonna focus and try to find myself the therapist, and see if we can have like a professional connection, and let's see what those exercises can help me with. And I am very kind of scared, but I'm gonna do this because this is not a nice way to live. And every time I feel pain in here, and my brain is telling me like, oh, this is the moment that it's gonna dislocate, and you know how bad and painful that was. And I get anxiety attacks from it. So yeah, I need that to stop. So this is what's gonna happen, and I'll keep you posted. And I'm hoping that in a couple of months, because she did tell me that this is not something that is going to be all good and well in a few weeks or even a few months. It can last up 6 months to 12 months. So I could be busy with this for a year. But hey, if it helps, then I'd be really grateful and happy. So thank you everyone for giving me the heads up, and telling me about your experiences and what it could have been. And I really appreciate the support. So phew, I'm glad that's over and done with. I'm gonna enjoy something nice. I think I'm gonna give myself a sort of reward. So I'm gonna either make something really nice, like ham and cheese, something toasty or something, or gonna watch a movie. I'm just glad it's all over. So thank you again, and keep you posted. Ciao.